Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh, and a very good afternoon to everyone present. I'm Manpreet Kour, a medical student from ZH the Women's Medical College. Welcome you all in today's session, which has been organized by Cause Sisterhood. Cause Sisterhood is a project which runs under the TAG movement, while the TAG movement is an educational and a leadership charitable trust. Cause Sisterhood is a non-political forum which provides a non-judgmental platform for everyone without any discrimination on the basis of any gender, caste, creed, or religion, and it is run by the young and talented girls and boys. I feel honored to introduce Dr. Debashis Mohanta Debu sir, who is an MBBS, MCPS in medicine, and currently working as a consultant in Zainul Haq Sikdar Women's Medical College, Dhaka, Bangladesh. Besides this, he also shows interest in many social activities, like he has been working for the minorities and also has a keen interest in music as well. Welcome, sir.
Thank you. Good afternoon.
Good afternoon, sir. Thank you for joining with us, sir.
Thank you.
So the today's session is all about the Omicron variant of the coronavirus. As we know, on 24th November 2021, a new variant of the SARS-CoV-2, which is also known as the B11529 virus, was introduced, and it was reported to the World Health Organization. The virus has added alarming levels to the ongoing pandemic, and it has already started creating havoc in many parts of the world. So here we are in today's session to aware everyone regarding this issue. So shall we start the session?
Yes.
So can you brief us on Omicron virus in a few lines?
Actually, Omicron, that is nothing else but the new variant of COVID-19. It is just discovered in some countries of the Africa. Nowadays, it is circulating all over the world and maximum countries nowadays. It is still under research. How much it can injurious to us, we still don't know about this. But Omicron, however, we have to be cautious about Omicron because in comparison to Delta variant, what kind of devastating it was. But if it is Omicron, same kind of devastating, what will be the mankind? So WHO and others, all the doctors, all the health professionals of all the countries and the political leaders, they're all the time, they're very much cautious about Omicron. So they are taking some preventive steps to prevent the people from the Omicron infections. So actually, Omicron is a new variant. Actually, variant change is the characteristics of a virus. This will be changed. But in case of Omicron, it is 32 times change of mutation in the spike proteins. This is the alarming. We still don't know how much it is virulent, how much it is dangerous and injurious to us. But when a virus changes genomes, the clinical features of a patient and also the sufferings of a patient completely different. So what is simple coronavirus, what is Delta wave, and what is Omicron has completely different clinical features. So this is Omicron. It is alarming for us, but we are also trying to know something about the Omicron.
Yes, sir. So I would like to start with asking you, what is the condition of the new variant in your country?
My country, Bangladesh. Oh, actually, we are now passing some relaxed period in our country, in Bangladesh, actually, because Delta wave was very much devastating and dangerous. Lots of people died and sacrificing their life due to Delta wave. But 2 weeks before, there was a news, there was no death due to coronavirus in Bangladesh. When I know this news, I just share it to my Facebook because it was very much enjoyable for us. And we rejoice for them. There is no death due to COVID-19. That means COVID-19 gone back, go away. So it is great relief for us. But the alarming, whatever, that is some new cases due to what is Omicron that is generating. So very much disappointed, very much disappointed. Even not a single case of Omicron, but unfortunately, yesterday we came to know that the two cricketers, field cricketers, who have come to Bangladesh from the Zimbabwe, that is roaming from the African countries, and 2 of them has affected by the Omicron. So so far I can learn from them, that is, they are still without any clinical features, without any symptoms. They are completely disease free, and rest of other than the players, other than the 2, they are also okay. They haven't no symptom at all. So Omicron very seems to me very much যেটাকে আমরা বলি বাংলায় রহস্যময়, that is very একটা situation যে what kind of symptoms it will create, or what kind of problems it will create, still we don't know. Very mysterious.
So, yes, sir. So proceeding towards the next question. So is Omicron likely to cause more severe illness? Like, is it more dangerous than the other strains that we have seen?
Oh, it can't be possible nowadays, because in this present situation, some cases are detected only. So WHO and all the political parties of the worldwide, they are very much thinking about the patients. They are taking care, they are isolated, and investigations are doing each and every time. But it is not the ideal way or ideal time to say it is not injurious or not dangerous, because we have to wait another 14 days or at least 3 weeks. If the people who are affected by the Omicron, after 3 weeks, 2 weeks, there is no symptom, no date, no respiratory disease, nothing else, then we can say it might be to some extent decrease in virulence and intensity of the disease in comparison to Delta wave.
Yes, sir. So what are the signs and the symptoms that can be seen in the patients who are infected with the Omicron virus?
Actually, in Bangladesh, personally, I have not seen any Omicron patients, but I have seen in this room, actually, lots of patients coming, fever, sore throat, running nose, even everything. Maybe might be case of Omicron, but I don't know still. But some cases when detected in South Africa and African countries, the doctor said they are suffering from actually flu-like syndrome. The fever, usually low grade, joint pains, and also the sore throat, running nose. These are the symptoms. But the loss of taste and smell sensation usually preserved here in comparison to Delta wave. So these are the symptoms. Actually, this symptom actually as same as the coronavirus. When 2 or 3 years before, lots of people when coming as such kind of viral illness, same kind of features that we are seeing in the Omicron. Still no feature. I want to add that is, I want to take some informations worldwide. No patients required any ventilation machine or suffered from severe illness or suffered from severe respiratory distress. I have not heard yet. So Omicron clinical feature, if you ask me, I'll give the answer: normal flu-like symptom, a dry cough, sore throat, it might be a running nose this time, might be diarrhea also.
Yes, sir. So can you please tell us something about the transmissibility of the virus? Like, how easily does the virus spread from a person to person?
Actually, it is 4.5 times more infectious than the Delta wave. Actually, it is less dangerous, less injurious, but more infectious. So it is transmitted from person to person. Actually, when genome changes occurs in African countries, when please try to think, when some people are going to the African countries, then coming back to your country, India, or even Bangladesh or any other countries, that's why it is transmitted. If we can log this movement of the patients or people from one African country to the others, so we can completely destroy the epidemiological channel of this patient, of this Omicron virus. It can be done. So it is transmitted as before by sneezing or by the respiratory droplets or by touching the same things which previously the patient used for them. That is, it is same. The transmission way is as same as the Delta wave and the coronavirus.
Thank you, sir. So the current vaccines which are available all over the world, like we have Pfizer, Covishield, or Sputnik for that matter, will they also work against the Omicron variant, or will we have to manufacture some new vaccines?
That is possible. That is possible. Actually, research when these vaccines generated, every research going on under COVID-19. Then the Delta wave comes, a new variant, then the Omicron new variant. Actually, should this vaccine work or not? Actually, this vaccine should work actually, because the main the mechanism of action of the vaccine, that is increase the number of T cells, and this T cell will kill the virus infected cells. That is everywhere is possible. But it is said in the African countries, some people is affected by the Omicron, they have also been vaccinated earlier. They have also been vaccinated earlier, but their symptoms seems to be decreased to some extent. Mild illness, minimum features.
Yes.
So vaccine can protect to some extent.
Yeah. So the vaccine is working against the Omicron variant as well. So the current treatment that we are giving for the other variants, will we give the same treatment to the patient who is infected with the Omicron variant?
Oh, in comparison to Delta wave, in Delta wave, we have to give lots of medicines to a patient because to prevent thromboembolic events and to prevent ARDS, acute respiratory distress syndrome. That was the mode of death in Delta wave. But in Omicron, is still not such kind of features. So one drug that is nowadays worldwide is generating, that is molnupiravir. Molnupiravir can be used. Molnupiravir can be used, and it is already used, and data says, yes, it works. It's a good news for us.
So are there any special tests for the detection of Omicron?
Now, actually, we go for the COVID-19 test, SARS-CoV COVID-19 test, RT-PCR for COVID-19. When this is positive, then go for genome sequence test. That can differentiate it is Delta wave and it is Omicron. Actually, this type of genome sequence change is not possible in all the parts of the country. Some parts, some specialist hospital can do it only. And so in Bangladesh, I don't know what about the India. Some places, some parts of Dhaka, some government under the government trial, just genome sequencing actually to detect the Omicron is going on. And not all the parts of Bangladesh. Even any part of Bangladesh, a patient is suffering from Omicron, and how much he is shedding the germs, it is not possible for us to detect.
Yes. So proceeding towards the next question, what measures are the countries taking so as to reduce the severity of the disease, to reduce the hospitalization, and also to reduce the spread of the disease from person to person?
Oh, as same as before, you have to wear the masks and sanitization, social distance. This is as same as before.
Yes, sir. So people who are, this is my very personal question, like the people who were previously affected with the COVID-19 virus, are they more susceptible to the new variant now?
Maybe, might be. Because some people who has history of COVID-19 infections, and still this patient has chance to develop infected by the Omicron. And it is happened also, it is some database, some studies said a patient can attacked by different variants of COVID-19. But to some extent, seems to me when the first attack and the second attack, when it occurs, second attack, in case of second attacks, the symptoms and clinical features to some extent decrease than in comparison to the previous one. But to some extent, patient is suffering from the Omicron or any other variants, but the symptom is decreased.
So what precautions should the people take in the current situation? Are there any specific precautions which have been added by the WHO or the government for that matter in case of the Omicron virus?
Actually, Omicron, we are thinking about Omicron, but Omicron will be as same as Delta wave, Delta variant. Still we can say. So we have to be cautious. We have to decrease the transmission of this disease. But for that reason, the government and political issues come forward. People should be warned, and hands should be cleaned again by the sanitizer. We should wear the masks. But it is also possible we shouldn't. We have to think about the what. If you think, try to listen, try to understand. If you think about the Delta wave, how much it was dangerous for us, not only the Bangladesh, Indian, all over the world. So when a people attacked by the Delta wave dies without any diagnosis, some people, and some people dies within 1 or 2 hours of respiratory distress. So when we can think this kind of features to a patient, so we all the time become fear about the Omicron. We don't know how much it is virulent, how much it is injurious or dangerous for us. WHO also saying these things, but they don't want to take risk. We don't want to take risk because the life is valuable. We don't want to take risk. So for that reason, we all the time say, yes, people, please try to wear masks again, try to start sanitizing again, making the social distances. We don't know how much dangerous it is. So wait for another 3 weeks. If there is no data for any death due to Omicron or any data due to severe respiratory distress, then thanks God.
Yes, sir. So proceeding towards the last question, can someone get infected with the Omicron and the Delta variant at the same time? Like, is it possible?
Same time? No, one after another. Same time, actually, it is not possible, but one after another, because a person can be infected, suppose dengue virus, a person can be affected by dengue virus 4 times, because 4, there is the genomic changes. And also coronavirus Delta variant, a person who is affected by Delta variant can also be affected by Omicron, because when genome sequence is changing, the virus characteristics, mode of transmission, action, and its ability to injury, everything is become too much different. So a person who is suffered by the Delta wave can also be suffered from Omicron. So that we have to be cautious. I have a, suppose if you think I have become a suffered case from Delta wave, so what Omicron can do to me? Never think so, because a person can also be affected by Omicron who is also affected by Delta.
Thank you, sir. So what would be your suggestion for the people? As we know that the people are getting very panicked when they hear that there's a new variant in the society once again. So what would be your suggestion for them?
Actually, we just request to alert the people. Just request to be alert for the people, but shouldn't be create any panic. Shouldn't be panic. We shouldn't be panic, because we should not let the people to be panic. Actually, we have to fight against this Omicron variant by our also social distancing, wearing masks, and sanitizing. That is enough. That is enough for this moment. And I request all the people, never be panic, just maintain these things. Definitely, God is merciful and we will bless us. Thank you. Anything else?
Thank you so much. No, sir. Thank you so much for a very fruitful and such an exciting session. We know that you were very busy. Still, you managed to take out some time for us. It was very great of you. And it was a very good session. Thank you so much, sir.
Thank you. Thank you. Thanks to you too. Thank you.
I would also like to thank Jaswinder Singh, who has been with us at every step, and with his continuous efforts, we have been able to organize such events one after the other. And last but not the least, I would like to thank everyone who has been with us since the beginning of the session. Thank you, everyone. Please follow the SOPs that have been given by the government. Do wear a mask, sanitize your hands, practice social distancing, avoid going to the crowded places, and also frequently hand wash, and stay safe and healthy. Please do like, share, and subscribe our page on Facebook, Instagram, and YouTube. Thank you so much. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.